For the beginning, could you please raise your hand if you are involved in the supply and procurement? And you are from the regulatory agency, right? Okay. All right. So let me start with this slide. And I was fascinated when we started preparation for this course, apparently with this analysis that was pointing on very high out-of-pocket payments in Armenia. So I also wanted to ask a colleague who is working with the national health accounts to give us a little bit of more information about the structure of this out-of-pocket payment. So Naira, please.
I will try to brief you about structure of household expenditures in the overall health expenditures. The overall assessment that we have, households have got very serious expenditures, almost 80% of overall expenditures. That consists of two main parts. One part includes overall health services, and the second part includes the overall costs of so I will say what was the basis of these estimates. The basis was the GDP production account of the national accounts, where we have got the overall health services, and in this context, based the statistics data that the National Statistics Service publishes as statistics of GDP productivity. By the principle of reductions, we have reduced it. We have added import, we reduced export, expenditures of the procurement, external donors, and expenditures incurred to the and we have received 536 million scope of service. It was the cost of the households for the medicine, for the drugs expenditures. We have used the final expenditures of the households. And you know that in the structure thereof, we have got 21 classificators of the health services produced based on our coefficient of the household survey, that households spend 4.4% for the drugs. We have calculated the drug expenditure from the overall expenditure. Again, it was something very serious, and we had two numbers. We have added the cost of the expenditures, 484 billion, or 80% of the overall health expenditures that we regularly rebid. About overall drug expenditures, I can say that 38.8% of the overall household expenditures per capita on the annual basis, on the monthly basis, it will make 5,200 Armenian drams. Շատ շնորհակալություն 38% կամ տնային տնտեսության ծախսերի մոտավորապես 1/3-ը առողջապահության համարսա գնում է դեղերին, կարող եք հասկանալ, թե որքանով է այս թեման կարևորություն ստանում։ Եվ եթե մենք նայենք մեր հայեցակարգին, վերահսկման տեսանյութ, իհարկե դեղերը կարևորագույն դերակատարում ունեն գրեթե բոլոր ոլորտներում։ Եվ մենք նշում էինք խոսենք նադեղերի մասին.
Payments, whether we were talking about organization of the healthcare, whether we were talking about behaviors and customers that also requires that also would expect satisfaction in terms of drugs and quality of treatments they're getting. So as this concept is also focusing on a health sector, I think it would be important to mention a few words about the pharmaceutical sector as another sector that is important, and it's a part of a broader concept of the health systems. So if we look at the global situation, the pharmaceutical real expenditures are in this country, as well as in most other countries, always higher than, in many cases, higher than the budget. And then the gap between the real expenditure and the budget is something which is happening very often. It's also one of the concerns. The reason for that are different. There is an issue of a sense of entitlement among the population. People are more and more requesting, demanding some of the specific drugs or pharmaceutical products. We have a better access to healthcare. There is a higher utilization of the products. There is a higher demand. We are dealing with a very clever industry marketing that is constantly pushing prices up. We have, as we were mentioned, demographic change and demographic transition with more aging population, more chronic disease that would require more treatments, more pharmaceuticals. There are innovations. There are new options, new demands, new products. There are orphan diseases and a new health agenda which are coming up. On the other hand, this is also a very sensitive area. We know that perception of corruption in pharmaceutical sector in relations to health is very high in a number of countries. So there is a lot of fraud, there is a lot of cheating, and there is a collusion among the providers. There is an issue of financial incentives for providers, whether they're coming from the industry or from somewhere else, but they sometimes also feeding this overuse of the expensive medicine. There is increased patient literacy as a very important factor, and finally, you know, we have a lot of courts decisions, legal decisions that are pushing us to increase costs of biological products. I would love to get from some of you what you think are the major challenges of the procurement and supply chain. Can somebody tell me what do you think is the most important function or challenge of the procurement and supply chain? Let me start with some of these, and then, you know, I would love to, please.
Հանճարկի ձևավորումը,
Formation of demand,
գների
difference between the prices and resource in the market. For example, in case of Armenia, well, we have a small market. Armenia is a relatively small market. Complex regulatory frameworks and very strict regulatory frameworks. Logistics. Լավ. Շատ լավ, շնորհակալություն, շատ շնորհակալություն. Գիտեք ինչ, մեր պրեզենտացիան հենց մոտավորապես սրա վերաբերյալ է լինելու, ես կփորձեի շատ արագ անցնեմ որոշ մեկնաբանություններով. Ինչպես դուք ասացեցի, շատ
So the consumers in this case are not only patients that are receiving that are demanding high quality drugs. There is also expectations from health workers that they will have they are dealing with the quality medicine that would make their treatments as effective as possible. We have public health priorities that we need to achieve, and we cannot achieve some of those without drug supply. I think about treatment of a TB, which is one of the examples that we were discussing a lot during these few days. In a previous session, we were talking about regulatory, and you mentioned the regulatory requirements as well as the quality requirements. They can be, they are very important, but also they could be a bottleneck in a sense to access to some of the products, and we will discuss a little bit further. We also we have a very strong interaction with the industry and the private sector in making sure that supply chain is providing whatever medicine is needed down to the patients. So this is another challenge of cross-sectoral collaboration that we need to find the best way how to deal with. There are public procurement rules that are pushing us for more and more transparency in a procurement process. There is more and more demands for agility of a supply chain, so we cannot allow ourselves to have some drug sitting somewhere in the warehouse. We need to have dynamics within the supply chain so the drugs are reaching people in the field. There is this ever lasting push probably coming from the ministries of finance that we always buy more value for the same money, and in terms of equity, importance is that we provide improve access of the poorest population to the essential medicines. Recently, we have added to the complexity, let's say, environmental concerns. So it's not just about the environmental impact of the pharmaceutical products, and I'm not only talking about the safe disposal, but right now we're talking about the green procurement, for example. How can we make a procurement that we are using that our carbon footprint is as low as possible. And finally, and this is, I think, one of the tasks of these workshops, is to really link whatever we're discussing with the wider change and reforms. This is one of the definition of a supply chain. A very complex systems or organizations, technology, information and resources involved in making a product reach to the customers. Failures of that mechanisms are producing stockouts leading to cuts in treatments and in health outcomes. What I think it's very often forgotten is that supply chain provides also crucial data on coverage and crucial data on needs for planning. And if we think about immunization, whatever we are talking about coverage with the vaccines at the local level, we are trying to see, to match that figures with how much vaccines they spend. So to be clear about what is the real coverage and reach at the local level. On the other hand, we need to be clear about how demand is working. If we see through the good data that there is a demand for certain groups of drugs or the certain specific medication, that may indicate that there are some of the health issues that needs to be covered. Recently, as similar to when we were discussing about behavior chain, supply chain is also now becoming almost scientific discipline. They have They have scientific journals that are publishing articles about supply chain, different models, different experiences from the countries, but also to say that supply chain is being increasingly professionalized, and this is how it always was with the private sector. This is now becoming a priority for the governments to increase the level of human resources in the supply chain. And we should not forget that proper functioning of a supply chain requires a lot of money. It cannot go without really resources to support this very complex operation. I would just go quickly through this concept. This is how a typical private sector supply chain is looking like. You have purchasing of the top. There are a couple of levels of distributors, wholesalers, retail pharmacies, and then drugs are moving to the patients, or patients are getting the drugs. This is a classical scheme that exists in a number of countries. What is important to understand in this model is that while drugs are going from the top down, and the money for drugs is going in the other way around. So that pharmaceutical sector is very interested in making sure that the flow of supply is going all the way through, because apparently they will not reach their final goal, which is actually to deliver a product, to get the money, and then to feed with the money profit and incentives to the other parties in supply chain. On the other hand, government chains are having a very similar structures. Structures are very often, let's say, determined by the geography or the political division in the countries. It's basically the similar in terms of different levels. What is different in those chain is that government is taking over the ownership and management of the whole supply chain. And this is where the problem starts. As I was saying, many governments are not investing enough in terms of human resources and in terms of financing. This is also the other way into looking into these government chains with the list of issues that are very common, starting with uncertainties in terms of timing of funds disbursement, no incentives for the staff performance, poor information flow within the system, weak capacity for distribution and planning. I think it's very important to understand that there are no single model that works in a country. Sometimes you go with the one or with the another. Sometimes you decide to have a government supply chain for some products, such as, for example, vaccines, and you let the other medical supplies to the private sector to deliver. This is a model of the OECD countries, in which they have a bit of combine of both, but basically trying to avoid some of the problems that government system may have. If you do, in a number of countries, when you do procurement at the government level, very often it happens that your drugs are being sold again at the lowest level. So through this system, you avoid one of these problems. This is just another look. The issue of data in a very complex scheme is very important. And even the best private sector struggle with data, whether it's data on forecasting, whether it's data on demand. Important issue with the data is that in a number of countries in our region where private sector is taking care of distribution, they are not sharing data with the government. So, for example, you have a situation where the people, let's say, leaders of certain public health programs would not have really information about how the drugs or vaccines are being distributed to the communities. Just to go quickly through, there is recently a study done in Zambia by Harvard University and supported by the World Bank. They were looking into the issues of the stockouts at a lower level. They were also looking into the issues of how the stockouts are basically affecting consumption. And well, they documented this issue that after any stockout period, the consumption is actually struggling. It's being lower than it was before, so it will take some time. Until the consumptions come to the desired level. One of the good concepts that was coming from this study in Zambia is they have no computerized system at lower levels of the primary health care, and they were struggling on how to pass information as soon as possible from the peripheral level up to the central level. So they did a very, I would say, simple approach in which they use technology which was available to everybody. Actually, they use people's mobile phones just to make a photo of the purchase request and to send it via mobile phone to the central level where they were processed and put into the system. So the critical issue is to understand the end demand signal, so that to understand really whether these people at the bottom of a chain receiving what they need to receive. What we learned from the industry, this is extremely important, and in many private sector industries, and you will see this in supermarkets, you have people from different companies who are actually checking whether their product is available in each and every store. In case of distribution of, for example, insulin, in a number of countries where private sector is taking care of that, their people would know even the list of diabetic patients that consumes their product, and they will contact them just to make sure that they have a supply on time. So, well, now, is there any comment? We have time is running. I need to rush. I'm sorry to this. We'll quickly move to the procurement. So, in a number of countries, procurement and supply chain are two different functions. In some countries, it's a part of a one function. I think the objectives of the procurement is that many people would translate this into 4 or 5 rights. You have a right product, right time, to the right person, at the right price. And this is definition of WHO, which more nicely describes what I'm trying to explain. Two major models that we use. It's the pool procurement that is centralized by the health authority, and I think we had some discussions on that during the session on the yesterday with Tihomir when he was describing the model in which Croatian health insurance fund, it's actually at the same time performing the functions of the National Procurement Agency. Framework contracts that are extremely important, particularly when you have a decentralized distribution in which basically you reach the contract at the national level with the for the certain products, and then all institutions, all eligible institutions from your system are actually pulling from that and benefiting from the price. As I mentioned in the beginning, the procurement process is highly regulated. It's the part of a public procurement, so needs to meet all requirements of the national public procurement system, but also other regulatory mechanisms that was discussed just in a previous section are having enormous impact on this process, whether the health regulatory agency is really providing a quality control at the entry level to the country and making sure that products that are entering into supply chain are of the optimal quality. Let's skip this one. So as we discussed this morning with Tom, what is really important is that you put all of these functions in a framework, that you have a policy for and a procurement strategy from the country that will decide on some of these critical questions. Whether you do central or decentralized procurement, as I was mentioning, you can do one or the other, or both, or or some products this way, some products in another way. Whether you do local, international, or group procurement, how you're managing additional risk with pharmaceutical goods, and we mentioned the counterfeited drugs. We mentioned the pharma mafia, which is playing an important role in a number of countries. But also, important is what is our policy on donations, because the donations is something where it's important in times of crisis or emergency, but needs to be really regulated in a sense so it's not distorting our supply chain and availabilities for drugs. Also, we need to be clear that the donations are area where the pharmaceutical sector can start entering on the back door, and we very often see situations like, particularly in the sector of laboratory services, where the pharma would donate free of charge the analyzer if you commit that you will be buying only reagents and other equipment from them over a certain period of time. So you are becoming then dependent on the certain brand or a certain company, and you lose the competition. We also need to understand how we're managing vaccines. Vaccines are really specific products and are coming through the market that is different very often from markets for other pharmaceuticals, but also to think about small volume drugs and particularly innovative medicines. We have, and I think in one of the sessions when we were discussing about the different powers within the health systems, we were discussing how, and there is a patient associations, right? How patient associations sometimes can be extremely powerful in demanding drugs for a relatively minor group of population with a specific disease, and how they can push that agenda so it's being prioritized. I was in Ukraine, for example, which is a neighboring country, very big. Now the former president of the patient association is the deputy minister of health, and for.
Today is her birthday.
Sorry?
Today is her birthday.
Okay, happy birthday. Yeah, exactly. So Olga was the one who was very much pushing against the corruption in the previous system, but was also a part of the association that was very vocal in promoting rights of about 400 patients in Ukraine, and we know that it's a country about 44 million people. Anyway, another issue is how we diversify our supply options. So it is really a challenge for all middle-income countries in this region, whether the countries are having a real access to the global pharmaceutical markets, or they are depending on local production. And again, going back to Ukraine. This is not me.
I'm sorry.
Good. No, that's okay. So you know that unlike in this country, in Ukraine, there is a very strong local pharmaceutical market, and they are extremely powerful force in decision making. At the same time, you know, when you look at from the regulatory side, it's totally different quality requirements for the local production versus the imported products. And while the imported products need to meet all possible quality requirements, you know, I think very little or no control over the local pharmaceutical markets, and that is becoming a huge issue in treatment of some patients, including HIV and TB. And what Tom was discussing with you extensively this morning is how we manage all political risks and the power of healthcare professionals, patients, and industry. And these are, I think, the couple of your groups pointed to this kind of issues. So what else, what are the, and I really apologize, I need to go quite quickly to this because we have around 10 minutes. So when we're thinking about other policy tools that you can use in dealing with the pharmaceutical sector, these are some of those: reference pricing, reimbursement ceilings, preferred brand strategy, creative contracting, regulatory of margins. There are a number of good examples from the region, and it's now pity really that Tihomir is not around, because he is the one, I call him Robin Hood of Croatia, because when he was director of the health insurance fund, he managed over 5 years to double a number of drugs in circulation and to keep the total budget absolutely at the same level. So the price control is something that is a extremely important part of the regulatory. We have different models that works in the different countries, whether in some countries all reimbursable medicines are falling under the price control prices, and for example OTC drugs and other medical products are at the free market. Other countries are using different models. Denmark is a very rich country, and they let all medicines to the free market, so there are no controls at all. Armenia and most of the countries in the region are using so-called indexing prices. You know that how we kind of define the price in Armenia. It's the index of prices in some of the neighboring countries. So we use that in negotiations with the industry, but also for planning of financing and the budget. This system is evaluated a couple of years back. Some of the shortcomings are that really benefits that this indexing is bringing to the countries are short-lived. After 5 to 10 years, they fade out, and you don't see the benefits of that. There are transparency concerns. You know, when you do the procurement and you have already fixed prices, there are no real competition, and in a number of countries, industry would use exactly the price which was referenced. Either they can, even in the cases where they can cut the prices further down. This system is also volatile to the exchange rates. Recently, there was a huge issue in Turkey where the country lost 30% of the currency in 1 year due to inflation. It created an enormous mess on in the pharmaceutical market. Also, in some countries leads to the bias in perception of value of medicine, because you suddenly get some medicines that are much more expensive than the other medicines that are in circulation, and that creates a lot of issues of misunderstanding with with industry. Then further is the risk of the availability of some products, because normally the products that you use through the referencing prices are very often mature products for the industry, so they're trying to discontinue production and move to the new product that would be of a similar nature, but then they can start with the new level of pricing. Okay. There is also another model which was called the internal reference pricing. I would just ask you to, if you find some time after to look at the presentation, I think it will be quite clear how it works. At the end, I think it's really important to mention that there are other ways of improving rational use of drugs, and through that to improve our financing situation. When we think about patients or the demand side, or the clients or beneficiary of the drugs, there are issues that we can improve through education, media campaign, but also to good screening, to good disease management programs, and to really reimbursement policies that will be incentive for the patients themselves. Prescribers, we were really mentioning them a couple of times. So the health workers, they have interest of having the best for their patients, but you know, very often they are under influence of the industry, and we know that this is an area that really needs to be regulated. Again, example of Croatia, where the regulatory agency made very strict rules about publishing all money and other support that was given to doctors through the pharmaceutical sector. And I think Nadim was mentioning on the other end this situation, the new law in Serbia that was passed just 10 days back, which was officially meant to reduce the corruption, but apparently seems to be really counterproductive. So when we talk about prescribers, there are very different incentives that we can provide to doctors to improve their prescribing practices. And it's also important to have, let's say, as much of the standardized treatments, or clarity in terms of benefits and treatment schemes. Finally, at the facility level, there's also important to ensure that there is really capacity to plan, to procure or to distribute medicines and the other programs, products, and that they have a capacity incentive to do so. And there is also a proper reimbursement policy so that don't keep their accounts below freezing temperatures. So yeah, that's I really apologize once again for rushing through all of these issues. I was originally hoping that we'll have a bit more time to go through, but would be pleased to take a couple of your comments or questions if there is any. Just one. Not a single one. Okay. So, yeah, please. Oh.
Yeah, I was curious. I was speaking with my friends at this table earlier about TB and HIV drugs, and I understand that the government is now starting to procure first-line and second-line drugs. But you mentioned something about, it's not pooled procurement, it's what strategies are they using to get cheaper prices? So they're moving away from global fund pooled procurement, and then what strategies can the country use now to ensure better prices?
We have changes in law, and now government can use the international agencies for procurement drugs, which will allow to have drugs with low prices, as they are giving the what they need to, for example, UNDP or other international agency, and they make this pool procurement for other such countries as well.
Okay, can I just comment on that? Yeah, thank you so much. I think this is a really important point. International procurement is extremely important model, particularly in the low-income countries. And countries in a kind of distressed situation like we had in Ukraine, you know, when their system got totally corrupt and they were not procuring any drugs, they moved all money to the international organizations. Limitation is that even at the international level, we have different prices for different level of development. So there is a one price which is for the poorest countries in the world. There is a bit of higher price for the low middle income countries. So you need to be clear that at some point you need to find a way, you need to find alternative mechanisms. But also I think a message for you in that process is that you maximize all benefits that you can get in getting technical assistance from the international community to build up your mechanism. And that's the one more. And we'll stop here.
Ինչպես նշվեց
as it has been mentioned on the drugs on TB and AIDS for 2020, we are currently targeting of purchasing these drugs through using the joint platform. But I have to mention that it's been already a sequence of years that the government has contracts immediately with the manufacturers of insulin for diabetes, and it's been already 5 years for insulin and insulin analog drugs. We have immediate contracts with the manufacturers, and we have lower prices currently, and we procure those low prices, as well as not only the mentioned drugs but also the ones that are also prescribed for patients with diabetes. And so in terms of the low item prices, we managed to cover more population, and the coverage has been increased. If a couple of years ago we managed to 50 or 60% only of the population. Currently, we provide all the necessary buffer amounts of the population.
Really good point for the closing of this session. And as you are now opening to the private sector and to the pharmaceutical markets, please be very patient and invest time and energy into managing those entry agreements and set the prices within the range that you can cover, set the quality standards, and set relations with the industry on a longer term. And thank you so much.
Ես ուզում եի ալտերնատիվների մասին խոսել։
I wanted to speak about the alternative drugs. I would like to speak about the AIDS and the alternative drugs that could be the generic drugs procurement. Currently, Armenia receives certain generic drugs through the Global Fund, which actually do not differ too much in terms of quality from the branded drugs with at the higher prices. And here we shall focus on the law on the patent and also royalties, because so that a country could benefit at the maximum from procuring generic drugs. Currently, the law on patent is being updated, and we hope that the updated law would be more efficient in this regard.
Important. So the AIDS is a global public health priorities. There are very different drugs produced in different countries that are of a very high quality standards but at very different prices. And I think it's extremely important that you understand, and WHO established a global mechanism which is called pre-qualification to ensure that the quality standards of those pre-qualified products are exactly the same. And when we're talking about AIDS, it's extremely important to have quality product that you give to your patients for the outcome of the treatments. Yeah, please. Thank you so much. Chief.
I have one question that I don't have an answer for, but what I've observed, especially in the situations, the growth of non-communicable disease that require intake of pharmaceuticals continuously. And how does a country ensure or give access to these types of drugs on outpatient basis? You already talked how to get drugs to the country with affordable cost, import cost, and also to make them sure that they are good quality. Mm-hmm. But how to operationalize this to the access of to the people? We know that in Armenia, very high out-of-pocket cost, and we know that a lot of this cost is for the pharmaceuticals. We know that currently basic benefit package includes very small list of drugs, pretty short. And we heard also example from Croatia where the list was 5,000 drugs strong. Currently, I understand a free or subsidized access to drugs can only happen if you go to a government health facility, and if they have drugs, they give it to you, subsidized drugs. Most of the Western world, they have turned this outpatient access to drugs as a special benefit under their health insurance schemes or management schemes. So if it's in the package, a licensed doctor or doctor who can prescribe it, and you can go with this prescription to the pharmacy, that can be public or private, it doesn't matter. You get the drug, and there is negotiated price, or there is a mechanism how to pay for that, and then whoever insurance pays the pharmacy of that, and patient may need co-payment. I haven't seen many in developing countries where we have worked that talk about universal coverage, that they will actually can address this problem. And I would be very keen to see, like, how do you see in Armenia this system developing? Will this be, we talk about private sector participation and provision, but if you go to private sector, they cannot give you a free drug because they don't have it. So you have to go and pay out of pocket. So this is why I started my question. I said I have a problem or a challenge to address, but I don't have a solution yet. I know that the government is currently in Armenia discussing, okay, the future of the social health insurance system. That will also include who are the beneficiaries, what are the benefits, and I would be very interested to see how the pharmaceutical benefit will be addressed. If the ultimate goal is to reduce out-of-pocket costs, that goes against drugs. Sorry, it was a little bit long, but I hope understandable what I wanted to say.
No, your point is extremely important. I think the part of it is, as you're saying, it's not all about the procurement and supply. It's about also financing. It's about prioritization in the countries. There are very different mechanisms. I'll just stop here, I promise. For example, you know, it was the case in a number of former Soviet countries, like in Ukraine. They have what is called national public health priority programs, which are funded through the separate line of the Ministry of Health. Now the TB vaccines and HIV is under that line, so these drugs are provided free of charge, or are supposed to be provided free of charge to the patients. Also, unfortunately, on that list you can find a lot of other stuff that not belongs there, but this is a part of prioritization. In our countries, we were having decades in which patients would be able to get drugs on prescriptions only through the government pharmacies. But then, you know, with the better standardization of the costings and prices, with the same prescription, you can go to the private pharmacy and get the drug. So there are different models, but I think all of you need to provide answers to these important questions too.